Megaloblastic anemia, MA, is a blood cell maturation disorder which results from impaired DNA synthesis. In this condition, red blood cells, RBCs, are enlarged, macrocytic, and blood cell changes occur. The impairment of RBC formation reduces the oxygen carrying capacity of the blood, leading to the typical symptoms of anemia, including fatigue, weakness, and other acute disorders. MA can result from any cause of vitamin B12 deficiency. It can also result from folate deficiency. Folate deficiency can have a dietary cause or can be induced by vitamin B12 deficiency because of the close interaction of the two vitamins, but B12 deficiency is the leading cause. When MA results from an autoimmune attack on stomach cells, which leads to a lack of secretion of intrinsic factor, which is necessary for the absorption of vitamin B12 into the blood, then it is known as pernicious anemia, PA. PA has historically been the condition most associated with vitamin B12 deficiency, to the extent that the two conditions have been viewed as being one and the same. This belief is so strong, that in classical medicine, vitamin B12 deficiency is diagnosed through the symptoms of PA. However, today, vitamin B12 deficiency presents far more frequently with neurological or neuropsychiatric symptoms without anemia, and PA is relatively rare in these cases. Instead of being the cause of B12 deficiency, PA is now said to be an end-stage manifestation of B12 deficiency, and can be prevented by early recognition of neurological/neuropsychiatric symptoms. In other words, PA develops gradually as the body's stores of B12 are used up and neuro symptoms are manifested. There are many types of anemia. In general, anemia is defined as too few or abnormal RBCs, erythrocytes, or too little hemoglobin, the pigment in red blood cells which carries oxygen. Anemia results in insufficient oxygen delivery to the tissues, causing symptoms such as fatigue, frequent headaches, shortness of breath, pale skin, loss of appetite, and mood changes. The symptoms vary according to the type of anemia. The worldwide prevalence of anemia varies by country, region, and population group, and the severity of anemia is often classified based on the hemoglobin level. According to the World Health Organization, WHO, mild anemia is a hemoglobin level between 10.0 and 10.9 grams/dl for pregnant women, between 11.0 and 11.9 grams/dl for non-pregnant women, and between 13 and 14 grams/dl for men. Moderate anemia is a hemoglobin level between 7.0 and 9.9 grams/dl, and severe anemia is a hemoglobin level below 7.0 grams/dl. According to the latest estimates by the WHO, anemia affects about a third of the global population, or over 2 billion people worldwide. However, the prevalence of anemia varies significantly by region, with the highest rates observed in sub-Saharan Africa, Southeast Asia, and South Asia. In these regions, anemia is estimated to be around 40%, with moderate and severe anemia affecting approximately 5 to 10% of the population. In contrast, the prevalence of anemia is lower in high-income countries, where it affects about 15% of people, and moderate to severe anemia is relatively rare. The BMJ best practice states that anemia is defined as a hemoglobin level less than 12 grams/dl in females, less than 14 grams/dl in males, or as less than 12.5 grams/dl in adults. They also state that it's the most common blood disorder seen in medical practice. Anemias can be classified in different ways. Under one classification system, the most common is iron deficiency anemia. Other essential groups are 1. Vitamin deficiency anemia, including vitamin B12 and folate deficiency anemia. 2. Aplastic anemia, the body stops producing new blood cells. 3. Hemolytic anemia, blood cells are destroyed faster than they can be made. 4. Sickle cell anemia, a condition where abnormal hemoglobin causes red blood cells to become stiff and take on a sickle shape. In megaloblastic anemia, a vitamin B12 or folate deficiency, which leads to a lack of the components required for DNA synthesis, means that RBCs do not form properly in the bone marrow. They appear as malformed immature cells, megaloblasts, in the bone marrow and blood. Incomplete DNA synthesis affects all cells, but is most pronounced in RBCs. Malformations include the retention of their nucleus. Healthy RBCs shed their nucleus as they mature, and an oval shape rather than a donut shape, which results in a cell size larger than usual, with a mean corpuscular volume, MCV, greater than 97 FL. These cells may also have a shorter life than normal RBCs, 120 days, meaning fewer of them than in a healthy person because they are released before they have matured enough to divide. Harrison's Principles of Internal Medicine, 2008, explains, the megaloblastic anemias are a group of disorders, characterized by macrocytic anemia and distinctive morphological abnormalities of the developing hematopoietic cells, all major immune cell types, in the bone marrow. In addition, the anemia may be associated with leukopenia, low white blood cells, and thrombocytopenia, low platelet count, in severe cases. Megaloblastic anemia arises because of the inhibition of DNA synthesis in the bone marrow, usually due to deficiency of one or two water-soluble B vitamins, vitamin B12 or folate, B9. B12 deficiency may also cause severe neuropathy, but whether this occurs with folate deficiency is controversial. In a minority of cases, megaloblastic anemia arises because of a disturbance of DNA synthesis, due to a drug or a congenital or acquired biochemical defect that causes a disturbance of B12 or folate metabolism, or affects DNA synthesis independent of B12 or folate. Macrocytic cells, enlarged red blood cells, are defined as cells with a mean corpuscular volume, MCV, greater than 97 femtoliters, FL, in adults, which is detected in a blood count. They are found relatively frequently and do not always indicate illness, unless there are other signs and symptoms. RBCs carry oxygen from the lungs to the rest of the body, wherever needed, and carbon dioxide back to the lungs for exhalation. They do this through the hemoglobin molecule, which is what gives blood its red color. RBCs need to absorb and release oxygen and carbon dioxide at a fast rate in response to activity. This means the cytoplasm, containing the hemoglobin, is always as close as possible to the cell membrane for quick delivery of oxygen and pickup of carbon dioxide. A healthy RBC has a donut shape, thin in the middle and thick around the outside, giving it a greater surface area to volume ratio than a sphere or ball shape. The cell has to lose its nucleus to get this shape, giving it a round disc-like appearance. A healthy RBC has an average MCV of around 90 femtoliters, FL, in humans. In megaloblastic anemia, the diameter of the RBC is the same, but the MCV can be up to 150 FL. If the RBCs are too large, small, or differently shaped, neither oxygen nor carbon dioxide can be effectively transported. This leads to a lack of energy and even muscle pains. Do you ever feel tired or experience muscle pains? These could be symptoms of a B12 deficiency, which affects many people. Vitamin B12 deficiency, which leads to megaloblastic anemia, can have many causes. These include any condition which disrupts the B12 absorption pathway, such as intestinal diseases, atrophic gastritis, a chronic inflammatory disease of the stomach which increases with age, and reduces the production of hydrochloric acid, intrinsic factor, and enzymes needed for digestion, gastric surgery, pancreatic insufficiency, small intestinal bacterial overgrowth, medications which inhibit the production of stomach acid, for example antacids and proton pump inhibitors, or autoimmune attack on stomach cells, called pernicious anemia. Other factors leading to deficiency include low dietary intake, and genetic predisposition to deficiency. Pernicious anemia, PA, is considered a disease of the elderly. The average patient presentation is around 60 years old. However, it is seen in other ages and children. For example, typical PA symptoms can be seen in children under 10 called juvenile PA. Pernicious anemia is an autoimmune condition where the body's defense mechanism, intended to destroy foreign cells and prevent infection or disease, turns on and destroys the body's own cells. Atrophic gastritis can also be an autoimmune condition. The autoimmune attack in PA is caused by several types of antibodies, which affect the production of gastric acid, which is necessary for separating B12 from food, and the output of intrinsic factor, which is needed for B12 absorption. There are two types of anti-intrinsic factor, IF, antibodies. Type 1 blocks the binding of vitamin B12 to IF, preventing the formation of the B12/IF complex. At the same time, type 2 binds to the B12/IF complex, preventing it from being absorbed across the intestinal wall. Since hydrochloric acid and IF are required for the proper digestion and absorption of B12, people with this condition usually cannot absorb B12 in the quantities needed to maintain health. Still, researchers have shown that food malabsorption rather than PA may be the leading cause. If an image of an elderly patient with pernicious anemia is the first thing that comes to mind when you think of B12 deficiency, take note, that image could obscure a more common case of B12 deficiency, one caused by food B12 malabsorption. This is because B12 deficiency can occur for various reasons, including inadequate dietary intake or malabsorption. It can eventually lead to pernicious anemia, PA, if left untreated. Early diagnosis and treatment of B12 deficiency are crucial in preventing the development of PA and its associated complications. In summary, megaloblastic anemia is a broader term for any anemia resulting from impaired DNA synthesis. In contrast, pernicious anemia refers to megaloblastic anemia resulting from a deficiency of vitamin B12 leading to a lack of intrinsic factor. Symptoms of pernicious anemia include fatigue, weakness, shortness of breath, pale skin, tingling or numbness in the hands and feet, and an increased risk of infections and neurological problems. Thanks for watching.